And so we're really working across globe and environments. If you'd like to talk a little bit just about the long-term impact, like both of you, Dr. Kingston and Desiree, and also Markus said, you know, there's so much more to share. I think you've heard each other's talks, so why don't we start with Dr. Kingston? So much more to share.
So I think, you know, it's really encouraging to see all the work that everybody is doing. I think all of us are trying to see people as individuals and treat them as human beings and recognise that all of the components of their life need to be seen in context together rather than split into silos. But yeah.
And it does sound like it's for both places is this micro environment. Let's make a difference in the community, in the immediate community, but the long-term impact is enormous. So Desiree, would you like to, or yeah, either one, just please go ahead. It's an open discussion.
Sure. Well, I think one of the things that really works in Namaste's favor is that we are not focused on scaling to serve a huge number of people. We're really going deep with this particular demographic of women that have already sort of self-identified as being incredibly hardworking and committed to supporting themselves and their families. And when you do have a fairly small client base, it's easy to really go deep and help address these systematic inequities that they've faced. And for us, I think the easiest way for us to measure our impact with our program is to see the change in profit, because we know that when women are empowered to earn more money, that they are investing that money back into the lives of their families and their communities at a much higher rate than men typically do. There was a study done by the UN a few years ago that showed that women reinvest in their families at a rate of 90%, whereas men tend to only invest about 35%. And so really focusing in on how to support them in earning more money is automatically creating better access to services that are really essential in developing a strong, equitable population. So for us, it was a simple solution that we knew would have an immense ripple effect.
If I may add to that, what I've seen in both talks, even though you are working on local communities, you've thought very hard about what the underlying principles are of the work you do. You know, you've been able to articulate those, you build on those, and that is what enables other people to scale it, right? So even if you focus on the communities that you're in, both of you in Helen and Desiree, then you still, by publishing it the way you did it, for example, today and other ways, enable other people to take that on, learn from it, and then replicate it in other places. And I think that's a big part of the power of the work that you've been doing.
And I think it is possible to solve things one at a time. If you get the solution right for the individual at the time that is right for that individual and move on, we are making a difference to the whole community, one step at a time. And often you have to make that a very individualized response. It's not going to be the same for everybody. Spreading things too thinly and saying everybody in a population will have a tiny bit of help, you're less able to demonstrate that to other people. And so seeing your ladies in Guatemala turn their lives around is not only impacting them and their families, but other people around them.
Yeah, I think that's right. Thank you. I think one of the things that's very exciting for me is seeing how so many of the women that start our program actually end up having their daughters or their family members join as well. to help them. And so in this way, I think that our program is making a real difference in the way women are perceived in the country, even if it's sort of on a micro level in terms of the number served, but how much respect they command when they're able to make a meaningful impact to their families and their livelihoods.
And because everybody, we are sort of dependent on implementing these programs, small scale or large scale, and Markus is here from the investor side, I want to ask about what is, and there are different countries represented, is there a clear path towards funding? Are there processes in place, or have you had to put processes in place? And from the investor side, do you have access to this kind of projects? Because I know many investors here. We just heard yesterday on a call, oh, there was a call from somewhere, and now 1 hour there is, I don't know how much funding. So is there awareness or a process in place, either from your side or as a medical practice, or from the nonprofit side, or from the investor side, that enables these connections and really contributing to some of these programs?
So this is an interesting topic for investors who normally invest in for-profit companies. One of the difficulties is that investing in many of those companies that are looking at climate change, for example, or in other areas, you know, with B Corps perhaps, that there often are not good ways of analyzing those. I mean, that's what I'm partly talking about, but also missing ways for nonprofits to get involved. And there is a perception often that, of course, B Corps in the US, which are looking at social causes or social issues more, and maybe profit is not the most important topic, that they have lower profits and therefore lower returns. A good experience is that in general, in impact investing, or where ESG criteria, environmental, social, and governance issues are being taken into account, that often actually the investment returns are just as good as in traditional companies that are just regular, just for-profit companies. But that is still a perception that needs to be overcome. And it's often hard to get investors even to look at companies that are more working on social, environmental issues.
I know from the nonprofit perspective, especially as a small nonprofit, and because we are so laser focused, finding the right partners, the right funding partners has been challenging for us, because in the nonprofit sector, it's pretty common for mission drift to occur when you find a funder that wants to do one particular thing, and that's not necessarily your secret sauce as an organization, but you think, okay, well, we can create a program that will make this funder happy. And Namaste, we've been pretty solid with our mission all the way through. So for us, we always try and look for funding partners that share our commitment to economic empowerment and empowering women. Certainly a regional focus is always helpful, but we do see a ton of synergy with what's happening in Silicon Valley with accelerators, for example. In a way, Namaste really is acting as an accelerator for these very, very, very small enterprises. And the great thing is that with a really small amount of investment in their training and in their microloans, the women are exponentially increasing their profits. So it's not necessarily a return to the investors, but the profit increases that our clients are seeing with a small investment is pretty monumental.
And we're hearing a lot that some of the investors and funders actually want to be involved in this project, sometimes as mentors. Do you have that case in Namaste?
You know, that's not something that we have been able to do yet. I think for us, because so many of the women are, first of all, dealing with very low education levels, and many of them speak indigenous languages, that can be a barrier for you know, people to volunteer as mentors. However, we're into exploring that, and especially in terms of technical solutions. We recently partnered with another nonprofit organization that has developed a business planning app for that's very culturally appropriate for women with this education level and this type of business, to empower them to continue growing their businesses beyond Namaste's program. And that's something that we just piloted, and we're excited to see how that really supports them in the long term. But we're definitely exploring more opportunities like that as well. So if anybody knows of anything, let us know.
I wanted to make an added comment also on what Oana asked earlier. When investors and entrepreneurs meet in the startup scene, for example, whether it's the angel community or VCs, there are certainly in places like Silicon Valley very well-defined application templates, formats, and processes for presenting your pitch to a funder or potential funder, and for the funders to review those. And one reason it works so well is that this is now very well understood here, and lots of people use that process to very quickly review many different opportunities. That often is missing in other areas. And I was trying to point to this earlier. For example, when Microsoft, for example, announced, they want to spend $1 billion in climate change, there are other companies, Airbnb, for example, want to spend on social causes. Very often, it's not clear how you actually get to that money. And there is both, there's not a clear application process. There are the criteria of what the company is looking for, and how to evaluate opportunities are often not well defined. And I think this is where nonprofits can help articulating what the criteria are, and people from the investment community who understand how to review and evaluate opportunities can help come in with templates, modify those obviously to the particular opportunities, and try to create something that if, for example, a community like the British were talking about earlier, wants to approach companies in the community, for example, that they can help them sort of have a common template for how to evaluate that and present.
Thank you. And I don't know if Julie can join us. She's working with Jenny Hartnell on these Mendip connections. Julie, can you hear us? Or can you connect at least audio? Let's see. Anyway, because I am seeing, and what I'm used to as well, this grant tracking, right? We try and apply for a grant, but what do we do in case of these dire emergencies? You can't go through a process that requires you to write 10,000 pages of something when people are dying. So I feel as a society, need to come up with something better. Let's just get this done. Let's get out of the emergency, and then let's build processes in place that actually allow, this is sort of, well, that's a non-brainer, right? We have to take care of these people. So we have all this bureaucracy along how to get funding, but people in the meantime are losing health and lives. So this is I know it's a very broad question, and obviously not for the two of you because nobody's responsible for this, but at some point we're all responsible for it. So how do we handle this? Like this situation right now with COVID it's teaching us something really important, and we need to step up. We need to step up every single process that we have. So how do we do that? I know, for example, that Amazon has these 2-page PR things and frequently asked questions. You can write about a vision that you have for the world, and whether you know how you're going to address it or not, that's all right. If they are bought into it and they're really looking at that, they'll give you the support. So that's one way, and I'm happy to share that with you. But what do we do about this?
I mean, this reminds me of the discussion of a vaccine for COVID-19 right now. On the one hand, yes, we would like to have one as soon as possible, but obviously one that kills more people than it prevents death will not be desirable, and therefore it needs to, it needs to be vetted. And in this case, fortunately, there is a well-known process that the FDA, for example, in the US, has to review vaccines, test them, and needs, before they actually can be sold. So I think that balance needs to be struck elsewhere too. You can do a lot of harm in a community if you come in with the wrong beliefs and the wrong approaches, too quickly thinking you have all the answers. And as you say, at the same time, you don't want to vet something forever before you try to have implement something. I think an important aspect of this is involving as many stakeholders as you can, right? And that includes the people who are affected, right? Is not come in with you think you have all the solutions, all the answers, but actually involve them as soon as possible early on.
So network ahead of time that basically conducts the buffer for an emergency situation. So since Dr. Kingston is back, I hope she's back. She left for a minute and now she's back. But if she's back, I would like to hear from her about the grant situation and the funding situation in the UK and how they work around this. What in the US seems a hierarchy or a certain path, and maybe we have something to learn from the British system and how they fund things. I think that we do have a connection difficulty with the UK for the moment. No, we're back.
I'm back. I heard your question. Sorry, I didn't think you could hear me. I think in the UK, general practice primary care is funded as a block contract. So we get paid for looking after a population, a little bit like a HMO organisation. So the incentives to medicalise and do more are not there. So that helps because we're looking at that whole population and trying to prioritise things. And the financial incentives are not there pushing us to try and do more medicalisation. I think the NHS has been constructed with different silos in it. So if I save money in a hospital budget, that money doesn't flow out to general practice. So you have to go back to the bigger picture and negotiate that. So there are some complexities there. But I think that principle that Markus was talking about of asset-based community development and building on what's already there and recognising if you intervene that the person is going to have that tiny amount of intervention time and then go back to their own life. So the more we can empower people to do things, the better, really, because that creates a resilient community that can then carry on. And so you're investing much more effectively taking that approach than by creating a dependency.
And we keep hearing this over and over about creating resilience from grassroots up. And one of the things that I'm noticing with, because you come from a medical perspective and Desiree is doing these economic things, but they're obviously linked. So a question for you, Desiree, in your organization, is there monitoring of these women's and their families' health as well? Are you able to work with some health component of this? Because it is really about their health and about their survival.
Mm-hmm. Yeah, so in our weekly interviews with each client, we always ask whether they know anybody in their communities who has been impacted by COVID. And initially that number was so low when we started these interviews in mid-March, and now it's about 30% of our clients know of somebody in their communities who have it. And I think that shift in awareness and making it more personal for them is causing them to take more precautions in protecting themselves and their own health. Another thing that we have been monitoring is, how many of our clients have chronic medical conditions that would make them vulnerable to COVID. And diabetes, for example, in Guatemala is a huge issue. Many women are now in a position where they don't have money to afford their medication, and they don't have access to a safety net to help them with that. So this is something that Namaste is not currently providing any sort of medical support, but as I mentioned in my presentation, we are offering our emergency cash grants, which in many cases goes to cover health expenses related to this, whether it's helping them cover their chronic medical condition prescriptions, or supporting someone in their family who is particularly vulnerable to COVID. So in that way, yes, we are intervening, and we're certainly always exploring partnerships with other social service agencies in these communities that we can connect our clients to.
And thank you very much, Desiree. It's very obviously a link. And also in Dr. Kingston's case, are you able to see in your community, because it seems like this community is really flourishing. So it's been flourishing in terms of health. Do you see the economical impact in your community, or maybe businesses arising or people doing better economically because they're healthier?
I think you see certainly an improved well-being and an improved confidence, and that can often then lead to thriving of small businesses and other things. It's not just what we're doing, it's what the Frome Independent Council are doing. It's everybody working together. So I don't think it's what one or two individuals are doing in a health centre that is making that difference, but collectively, all of us working together with a common theme is moving the town forwards and making it a more prosperous and a more optimistic place where people value green spaces, value time with other people, and feel more confident about the future. I know COVID has given us all a really big knock at the moment. Lots of things have had to stop because of COVID, but at the same time, there were lots of those individual acts of kindness, neighbour to neighbour, people doing little things for each other in that vacuum, which are really, really valuable long-term benefits of relationships that are forming, not in a dependency way, but because your neighbours, your friends, you're living with.
The audio has interrupted a little bit. So maybe we could go in the meantime we'll see if we recover video, but I do have a question for Markus. There's been a huge deal in the world about immigration and a lot of the US border. And a lot of it is actually, we see these waves of human migration, and part of it comes from Guatemala. And the reason it comes from Guatemala, actually, this happens to be a coincidence, but it's because of climate change. Parts in Guatemala that were fertile before have become deserted, so people really cannot grow their
result. And that will also beyond strong bonds that are being formed.
Sorry, we got a little bit interrupted, but I think everything got recorded, even though we weren't able to fully hear you here. So I was asking Markus this question about the human migration really that's happening right now. And it happens to be out of Guatemala. I actually didn't realize this was not on purpose. I happened to invite Desiree to this and Markus, and I just realized, wait a minute, there's a connection there. Guatemala is very dry. People cannot afford to grow food anymore, so they need to move. How do this is something we need to pay attention. So from the environmental perspective, Markus could comment on that.
Well, there's no question that climate change is a global problem, and that There is some potential to adapt. So if you don't do that, what's the third in my, the three categories of action we can take. The third one is if we can't head off climate change, then we will try to adapt. The richer nations have more resources to actually do that. The poorer ones don't and often have to leave. Whether that's the ones that are suffering from desertification, lack of water and so on have to move, or increasingly the low-lying, island nations will have to move, and some of them have already started on that. Or the ones that, like Bangladesh, are very close to the water. A big part of the country is already regularly underwater. Or if it's Miami, right? Miami is getting flooded every day, essentially now. And that's even just with regular weather. I don't know if I have anything new to say to that. It's definitely in the interest of the developed nations to help the developing nations, the ones with less resources, to deal with local problems. Ideally, before that, of course, invest in heading off climate change, so that hopefully many of these catastrophes won't happen. But then otherwise, as much as possible, help locally, because otherwise they will come to try to move north. It will happen even within the US, right? At some point, it will be too hot to live in Arizona and people will move north from there, and or less land in Florida, etc. So all I can say is I think that it's definitely would behoove us here and in our interest to help them locally first, in addition to working on climate change as a global problem.
We do need to find also for climate change even local solution. Again, microenvironment, but a global problem that we're dealing with. So I would like to call this roundtable to a wrap up, but invite you to share any closing remarks if you'd like about anything that is your next interest or anything that you think the audience will benefit from. And the audience is really, this is going to be broadcasted live on YouTube. So the audience is large.
I want to emphasize 2 points that I made in my presentation. One is to educate ourselves. I think these are important topics, social issues, environmental issues. The more we know as investors, as entrepreneurs, as people working in nonprofits, the better we can contribute. And then the second one is a lot of this requires collaboration. There isn't a single person or a single side that is able to impact, create solutions by themselves. And I think this is more important. There's kind of a division of labor traditionally between entrepreneurs create a solution and investors just fund them. But I think here there needs to be collaboration much earlier. Mentoring. It needs to be nonprofits involved in helping with shape, for example, regulatory changes and so on. So I think we all need to work together before solutions get created in order to set the foundations and the context environments in which the solutions then can be created and flourish.
Thank you. Desiree?
Well, I think from my perspective right now, the whole world is inundated with so much information about all of these problems that we're all facing. Here in the US, it's just a never-ending flow of seemingly impossible obstacles. And I think one thing that is helpful for me is focusing in on how to solve one problem. And I think as we're looking at COVID, as we're looking at all of these other things, really focusing our energy and our investments in things that we know are making a tangible impact in people's lives. And so, despite all of the turmoil that the pandemic has caused, that's something that Namaste is really committed to, is using our data to help inform our interventions, and making sure that we're doing it in a strategic way. And I also just want to say, you know, it's very exciting for us as a small nonprofit to be participating in this conversation. It's rare that we have an opportunity to share our story. And I know that there are so many incredibly intelligent and enterprising people that are part of this community. So I am excited to represent Namaste in this conversation, and I hope for more opportunities for collaboration. And if anybody has any questions about our work or wants to get more involved, please do contact me.
Okay. Dr. Kingston, it's really an honor to have you here, actually. It's exactly what Markus said. Small nonprofits need to be involved in regulatory and need to have access to everything. We need to work together. It doesn't matter where we are. Dr. Kingston?
I think, you know, we've had huge challenges with COVID, but at the same time, when you look at the responses that have happened, we would have said populations will not allow us to make these big changes. It does offer us hope that populations and governments have had to respond with big changes for COVID. They can do that for climate change too. You know, 6 months ago, we would have said, oh, no, people won't wash it. It won't happen. It's too big, it's too difficult. But because of this crisis, we've learned that actually we can move very quickly when there is a crisis and we need to. So hopefully bringing some of that can-do attitude forwards, although obviously there are lots of difficulties at the moment.
Wow, what an inspiring thought that we actually can do this, even globally, even on environmental level. Thank you so much for sharing that thought. And actually, thank you again for joining us from London, and I hope from England, and I hope we keep in touch and something will happen. I'm glad to hear you're working with a Canadian university, and we'll want to learn more about it and how to implement some of the models, because clearly they're working. So thank you very much. Thank you, Desiree. Thank you, Markus, as well, for this wonderful panel and this level discussion about we're back to basic needs, but basic needs of the individual and basic needs of population and basic needs of the planet.